If you've been to the doctor for RSI, chances are pretty good that you've been written a prescription. Did you ever stop to think about whether that prescription might be inadvisable, or did you look up the side effects? Recently, there was one of the commonly prescribed medications for RSI are a group of medications called nonsteroidal anti-inflammatories. And according to a study in the Medical Journal of Australia, the use of these drugs to treat muscle, ligament, and tendon injuries should be reassessed. The study claims that they have at best a mild effect on relieving symptoms and are potentially deleterious to tissue healing. So today we're going to hear from Dr. Robert Markison. He's going to talk about these and other drugs. What would you like to say about the side effects of NSAIDs?
Well, I think they're overprescribed like many drugs. Sometimes you need them if you're post-surgical or you've had an injury and it's an acute problem that's going to resolve with a finite course of those kinds of medications. I guess the problems that I see are overprescription, too much consumption, and subtle but significant irritation of the stomach, such that you really kind of change a lot of things suddenly. And so patients, for example, who take Markison, which is Aleve, or other anti-inflammatories on a chronic basis, can threaten the natural bacterial flora called the microbiome that really runs the full length of intestine, mostly in the end of the small intestine and the colon. And so if they complain of gastric irritability, one thing leads to the next, and they're prescribed acid blockers, proton pump inhibitors like Nexium, and so omeprazole. And so what they do, sadly, is they start to interfere with the absorption of vitamin D, B6, B12, C, A, and a variety of trace elements. So now the Rob Peter to Paul equation, meaning get the stomach quieted, so to speak, so it can tolerate a non-steroidal, means that you're going to have more problems and maybe some longer lasting problems. I'm not totally against non-steroidal anti-inflammatories, but they must be used minimally and occasionally and not chronically.
Well, that's good advice. I mean, it's interesting now that you're talking about it because there's so much in the news about probiotics, which are another topic that maybe we can get to at some other time. But I wonder if the anti-inflammatories would also interfere with that process.
Well, they do. I mean, any medication you take may not be microbiome friendly. And the disturbance of the microbiome is called dysbiosis. And your brain weighs 2.5 pounds, and your microbiome, including the microbes on the skin plus the intestine and other surfaces, equal the same weight as your brain, 2.5 pounds of friendly bacteria that can turn hostile quickly.
Wow. The second brain, as they call the gut sometimes. There's another commonly prescribed drug, Neurontin. Can you tell us about that, Dr. Markison?
Well, Neurontin is often used for nerve problems, nerve irritability, nerve-related pain, probably overprescribed. And okay, so it frequently causes weakness, tiredness. It frequently causes high blood pressure, frequently causes dizziness, paresthesia, meaning numbness and tingling, change in reflexes. And then there are less common things Neurontin does, but the most common complaint I have from Neurontin consumers is that they feel weak, a little dizzy, a little confused, don't want to drive for safety issues, and they're not getting too much benefit from it. And then the dose goes up and the side effects increase.
We'll get to this later, but it seems like something from the complementary world may be helpful. You know, something, for instance, acupuncture or something soothing, maybe biofeedback might be effective without causing those kinds of side effects.
Right. I mean, you're heading for the list of things that probably help.
Good. Then there's another group of commonly prescribed drugs, and one of them is antidepressants. So I think some of those are described off-label, but there is, it's not uncommon for people with RSI to be depressed. Can you talk us through that?
Yeah, I mean, your best shot at a mild antidepressant would be Mother Nature's St. John's Wort, which comes better formulated in tablets than capsules. And a lot of my patients who are brilliant, creative, but somewhat chronically depressed with or without strain, just take 450 milligram tablets or maybe 300 milligram tablets, depending on size and weight of the person, in the morning. And so Source Naturals in Santa Cruz seems to formulate the best, most consistently helpful St. John's Wort tablets. That's Amazon.com. And so rather than take a prescription antidepressant, they tend to do well with that. They can take it somewhat chronically without trouble, up to about maybe 900 milligrams a day, if absolutely necessary. Comes from a little yellow flower. And it seems to work really well. If you're going into prescription antidepressants, most of which are serotonin reuptake inhibitors, consumer beware. They may help stabilize mood, but they can do so at the expense of various systems with various side effects. And if you'd like a few examples, I'm happy to give them. Sure, I mean, if you look at Wellbutrin, a commonly prescribed antidepressant that frequently causes high blood pressure and palpitations, and frequently causes a lightheaded feeling, can cause or aggravate migraine headaches, and frequently causes joint pain, muscle pain. And so if you look at that array of things, it doesn't mean be afraid to take Wellbutrin, but it may not be as body friendly as you'd like. Now, if you go to Zoloft, another commonly prescribed antidepressant, frequently causes chest pain, frequently causes increased appetite with associated weight gain, often causes back pain and weakness, frequently causes muscle aches and pains. So these are things that can come up independent of drugs within a repetitive strain injury context. And so why make it worse? Here again, these are decisions made by hopefully holistically thinking, but capably prescribing MD psychiatrists and or internists, but people really well aware of not only medications, but their side effects, overlaps with the repetitive strain injury, for example, and know when to hold them and when to fold them. That's incredibly important. I've seen so many over-medicated people where there's been no uber mind thinking about pharmacovigilance and drug person, drug food person side effects. Now we're getting into the weeds a little bit, into biochemistry, cell biology, physiology, and things that help and things that hurt. But nonetheless, you really need an organizing person to hold it all together and know when to say stop. And that's not cold turkey stop. For someone long-term antidepressant dependent, it can be a very, very long taper, 6 to 12 months. But it needs thinking and rethinking to avoid overprescription of polypharmacy.
All that we've been talking about plays into my philosophy of repetitive strain injury, which is you need to look at the whole picture, the whole person, and all the interactions that you were just talking about. I mean, from the microbiome to, food interactions with some medication that you're taking. And I really think that, especially if there's an alternative available that's effective, that won't cause these side effects, it's worth exploring with your doctor. Is there anything you would like to say about that? You were on the verge.
Yes, certainly. I mean, obviously, you don't consider medicating a depression until you consider any and all possible organic causes of depression. The most common overlooked high prevalence cause of depression is vitamin D deficiency. One of the second most common causes of overlooked organic cause is hypothyroidism. And so should be thinking about that. Even pre-diabetics can become depressed, not just because of hyperglycemia, but